a doctor prepared nurse practitioner in Thomaston, Connecticut. I have a solo practice. It's called the Practice of Health and Wellness. At this practice, I do some primary care, but I generally specialize in chronic inflammatory diseases like chronic Lyme disease, tick-borne diseases associated with Lyme disease, some of the co-infections like Bartonella, babesiosis, ehrlichiosis, things like that. I also specialize in chronic urinary tract infections. So I was trained with Dr. Richard Horowitz for Lyme and associated diseases, and I was trained with Ruth Kriz, nurse practitioner. They're both excellent practitioners who were excellent teachers, and so I feel very comfortable with what I do. Anyways, this is the third video that I'm making, just trying to explain my point of view of the medical system that I've had issues with myself, so that you know that when you come see me, you'll feel more comfortable, because I'm a real person and I've had some real issues, and I've had some really great doctors and really bad doctors. I'll be perfectly honest with you. So the first two that I already spoke about was when, I had a minor stroke. I was able to have an excellent doctor who diagnosed the anticardiolipin antibodies and got me on an aspirin a day, and I've been good for 30 plus years. And then the other one was when I had thyroid cancer, which that was a mishmash of 4 primary care doctors, a pulmonologist, a cardiologist in a 2.5-year period. And it wasn't until I finally passed out from lack of oxygen that I was actually diagnosed properly. So when I say that when you come to my office, I listen because I know what it feels like to have your issues fall on deaf ears. It's a horrible feeling, especially when you have a provider telling you that your symptoms are all in your head. That's the most ridiculous thing I've ever heard in my entire life, personally. Anyways, my third wonderful experience I had with this body of mine, I was in graduate school. I was in school to be a nurse practitioner, and I had 1 more year to graduate. And I was at a conference at Hartford Hospital, and I was annoying this poor physician who was sitting next to me, because out of nowhere I developed like a Charlie horse in the back of my left thigh, and it was pretty painful. And I had to excuse myself to get up and walk around and try and get the pain to go away, and sat back down again, and a few minutes later had to get back up again. That was on a Thursday. On Friday, I went to see my chiropractor. Love chiropractors. I am a huge proponent of chiropractors and naturopaths. I'm going to put that out there right now. This chiropractor popped me back into place, I can't tell you how many times. And he did an examination. He did some muscle testing, did not do any adjustment, and said to me, "I cannot fix this. This is going to be bad." And I remember the tears rolling down my face, thinking, oh my God, with all the things, all the stupid things I've done, all the injuries I've had, all the times he's put me back together, he's never said that to me. So that was pretty frightening. So that was a Friday. On Monday, I made an appointment with my nurse practitioner, who did all of the neurological testing and all. And at that point, I had lost all my reflexes on my left side. So we knew it was going to be bad. I also couldn't stand on my toes. I had lost that reflex as well. The only pain I had was that Charlie horse behind my left thigh. That was it. I had no other pain anywhere else. So now I go for an MRI that really didn't look all that bad. All it showed was that I had a cyst in where the vertebrae is, which is pretty common for people who run quite a bit and are older. It didn't explain the pain though. And so I had seen a Dr. Arnold Rossi, who is now retired. He's a neurosurgeon, and he saw the level of pain I was in and was going to hospitalize me. Because at that point, so this progressed very quickly. It went from a Charlie horse to the back of my left thigh to an excruciating vice around my whole left thigh, where I had to just, wherever I was, which wasn't many places because I couldn't really go anywhere at that point. This was like within a few days. I have to lie down on the floor, on the carpet, wherever I was, flat on my back, to allow this spasm to go away, and then I could stand up again and maybe walk a few feet and back on my back again. It was horrible. So he saw the level of pain I was in, and he was going to admit me to Hartford Hospital for pain management. As luck would have it, my dad, who was in a nursing home, took a turn for the worst, and he had double pneumonia, and I was his power of attorney. And so we turned the car around. I went to the nursing home, had the conversation with my dad that it was bad enough where if he was hospitalized, he was going to have to be intubated, and he made the decision that he didn't want that, so we put him on hospice. And at that point, I didn't want to leave my dad to have surgery, so the nursing staff at Apple Rehab in Watertown was absolutely wonderful. They set me up with a recliner that reclined almost all the way back, so I was actually able to stay with my dad the entire time I was with him, just lying flat on my back. After he passed, I don't know what happened, but I had zero pain, no pain whatsoever. I could not feel my leg. I had complete foot drop on my left side. After the funeral, I really considered not having the surgery done because I no longer had pain. And from the other side, I could hear my father saying, "Don't be such a thickhead," because I'm Italian. Of course, I could be a thickhead. Don't be such a thickhead. Just have the surgery done. So I called Dr. Rossi back and explained the whole situation, and I was ready to have the surgery. And so he did the admissions and everything else like that. Well, I think what I admired about him the most was that my MRI really didn't look bad at all. It did not explain the level of pain I was experiencing, but he believed that I was in this kind of pain because he saw what I was going through. I know what patients go through, and I know sometimes the medical community just doesn't understand that what you see on an image and what you find in the operating room are entirely different things. I did learn that after I became a nurse practitioner. My first job was in the Department of Surgery, and I can tell you when the surgeons were shocked sometimes because what they found on a CAT scan or an MRI looked like nothing, and then they opened a person up and it was just a disaster. So I was fortunate enough to have a doctor who really, really listened to me. And so when he did do the surgery, he found that I had something called conjoined nerve root, where I had two nerves going through the same foramen. So like each one goes through a vertebrae, so it's nice and leveled out, spaced out, I should say. Mine was completely congested. Plus I had this cyst that formed. And so he had explained how he had to separate the nerves, he had to use a micro scissors, he had to get all the cysts out of there, which was very gooey and sticky, and explained that I wasn't going to feel a lot for quite a while. And as the nerves rejuvenated, which could take up to 9 years, I was going to go through quite a bit of pain until everything kind of rejuvenated itself. So he had given me gabapentin. What he didn't do right, though, was he gave me the gabapentin 300 milligrams 3 times a day for somebody who doesn't take an aspirin. I do take an aspirin because of the stroke. I don't take Tylenol, I'll put it that way. And I literally walked into a wall. So after I became a nurse practitioner, I did a little bit of research on gabapentin and I started people very low on 100 milligrams, and I slowly worked them up because I know what I went through. He did wake me up in the middle of surgery because the amount of bone he had to remove, he really wanted to do a fusion. And because I was so close to graduating and knowing that a fusion was going to give me 6 months out of school, I was so afraid I was never going to finish my degree. So I said to him, I didn't want a fusion. I just wanted him to fix whatever he could just to get me through school. And then if I needed a fusion afterwards, I would get it done. Well, knock on wood, it's been, my God, how many years? 14 years now. And I am a fiend at working out. So as soon as I could, do the yoga, Pilates, core strengthening exercises, all that stuff, I was back into it. And within about, I want to say 12 weeks, I was back to running. But I had a Gestapo for a physical therapist. She was this tiny, 5 foot tall, 90 pound soaking wet woman who kicked my butt. I'm not kidding. And most of it was my fault because I said to her, I need to get back to where I was. I cannot not be where I was. I love working out. It's the one thing that really keeps me healthy. And she got me back to where I had to be. I did my last 5K was in November of last year. I feel absolutely amazing. I'm actually going skydiving on Sunday with my son, my daughter-in-law, and a bunch of friends. My other son, Evan, who's actually my son's best friend, but he's like my son. So my point is that if you have the right doctor, especially somebody who listens to you and understands what's happening in your life, you can't imagine how far you can go. If you have the wrong doctor, it can really, really cause a pause in your life until you find the right doctor who really listens. And so my point is that I've been through a number of health issues. I've had really good doctors. I've had really bad doctors. I've had doctors that listened to me, and I've had doctors that just didn't listen to me. I can tell you I really listen because I really know what it feels like to be a patient. And I never wish harm on anyone, of course. But I feel as though if more medical providers were patients at some point in their life, they might understand what a patient is going through sometimes. So this is my third video. My next one is going to be on something different. Again, I'm Pamela Cipriano. I'm a doctorally prepared nurse practitioner. I have a solo practice in Thomaston, Connecticut, and I'm here to help you. The website is apracticeofhealthandwellness.com. Our phone number is 860-880-2525, and I would love to help you. I really would, and I'm sure I can. Take care. Bye-bye.